Welcome to HUS's Looking Ahead. In this project, we are interviewing professionals from different stratas of the society to help us understand the challenges they faced during the pandemic and how they tackled them. Today, we have senior physician Dr. Kailash, who's a chest consultant and the director of Asthma studio in Velachery, Chennai.
So, generally, to my knowledge, people sometimes tend to exaggerate what they feel, like the way the media has spread information about COVID. I'm sure people overreacted for a normal cold. So, how was it like to deal with these patients?
Fine. First, man has got a tendency to exaggerate everything. That is our quality. Apart from this, media has done their role by putting frightening videos, particularly about this COVID. Like I saw some videos like a person having fits once he gets this thing, and people falling down just like that, walking on the road and dying like flies and all this stuff. So this is very frightening thing which media exaggerated about corona, and I don't know how many of you are all aware that corona is nothing but a virus. It's an animal virus. Normally, animal virus do not come into the human body. For some unknown reasons, many of these animal viruses have jumped into the human being, adapted themselves, and produce. Like we have a lot of virus like MERS virus, SARS virus. All these came in our medical history, which entered. This coronavirus also is a bat virus. Actually, man did not eat bat. Bat bit sheep and so many fowl and all that. And that infected meat were taken by people at Wuhan, China, and they developed this corona and then started spreading into the human being. The virus got mutated and got into our human system and produced all sorts of problems like flu-like symptoms. Like generally, flu-like symptoms are fever, headache, body pain, and all that stuff, which every virus has, and produce pneumonia, which was deadly. So people started dying like flies, and that is why people got scared. The pandemic that created in the last 2020 was really bad, and people were the entire lifestyle of the people were affected, shattered. But it is just not exaggerated. The thing is, it did bring a lot of changes in the human system, in human lives, and that is why people got worried about it, and that is the reason. It's just not exaggeration. It is.
To our next question, in fear of contracting the virus, we have been scared to visit the hospital to get ourselves diagnosed. What are the changes that you have made in your hospital to ease that fear, and how was that transition like?
This pandemic made, in fact, we closed our clinic for about 6 months. In fact, I closed my clinic for 6 months. The doctors were so scared initially because, after all, we are also human beings. We also get worried when people die like this. But slowly we bounced back. We thought as frontline workers, we have to get back to work, and we bounced back, got the courage somehow, and some started counseling all our patients, who came to the hospital. Slowly we counseled them about the symptoms and all that stuff. People who came with cold, we told them it need not be corona, don't worry, but we'll do the test and then we'll take a call. So, and slowly the mask came, and hand washing, distancing, all this the doctors gave it to the society, and this fear of this really came down. But many of us were literally scared, really scared initially. I still remember 6 months I did not step out of my house to go into this. But slowly we were the ones who came back. We came back and started getting our schedule back. Doctors changed the mindset of people slowly by announcing. Of course, government was also very helpful to us, and we did a lot of work initially as frontline workers to change the mindset of the people, and it did happen. It did happen after some time.
Doctor, because of this fear, we understand that there have been alternatives to actually visiting the hospital, and one such alternative is online consultation. Online consultations have become common these days. I'm sure there are some limitations to it. What suggestions would you like to give your patients in order for them to get the most out of their online consultation?
Online consultations have come to stay of late. Certainly, I have to agree. It's not new to us. Online consultation, we have been doing it many times, even earlier, before Corona also. People used to call us, but that was not the thing, Now, because of Corona, we had no other choice. We were pushed to go for an online consultation. And it did help us during the crisis. During the crisis, at least we had some contact with the patients. We were able to see them through the video, and we could prescribe drugs. They had some relief, though not fully, but some relief. Online consultation have got some disadvantage. Like, you cannot diagnose 100% properly because it's only symptoms. I ask you a few questions. Do you have sneezing? Do you have sore throat? Only with this symptom I come to a diagnosis. I don't examine you. That's the biggest problem with the online consultation. Investigations really help us. We'll tell them to do this investigation, get back to us, and then we try to help them. So online consultation, of course, the biggest disadvantage is that personal touch. We don't have that personal touch. The advantage was we are able to help them during crisis. We are able to help them together. And a lot of platforms have come. For online consultation. And now we are able to do online consultation. And I have a feeling this is going to come to stay, this online consultation. Because now, every day I do about 10 to 20 online consultations only. Even now, though Corona has waned away, that's what we think. Now, once again, because of the second wave also, this has started. But a lot of people have started liking it. Outstation. We have lost a lot of patients now because they are, say, patients from Nagarkoil and Tirunelveli. They jolly well sit at home, do an online consultation, take the medicine, and enjoy. But somehow, I feel that element of personal touch is missing in online consultation. But it is a wonderful system, online consultation, because it has helped us through a crisis. It has evolved nicely now. That is going to stay for a long time to come.
Okay, thank you for clarifying that, doctor. We've also seen a lot of people speaking up about how the virus has affected their mental health. You were saying how you stayed at home during 6 months, and so how are doctors' physical and mental health affected, and what measures are used to cope?
It did shatter all of us, including the doctors, this Corona. There has not been a time, even when I went to States, only 2 months or 1 month, I'll close the clinic. But I've never closed my clinic in the last 45 years for 6 months to 7 months. This has never happened in my lifetime. So naturally, this will help. This will shatter my ego. I felt very bad. I was almost depressed, not seeing people. Forget about not seeing patients. I was not able to see my neighbor. Nobody was willing to see anybody. Just see what will happen to them. If children are not allowed to go out and play, see just what will happen to them. They'll become very aggressive. So the mental status of all of us, including doctors, were shattered during the pandemic. It was shattered all over the world. In fact, lot of depression, lot of anxiety, neurosis, all that came, hypertension, many things came because of this Corona. But man is one creature who will always try to come over, get over everything and settle down finally. So now all of us have come back to normal. Now we have settled down. And of course, this vaccine really gave us a boost and we are able to see people in person. But still, the mental agony was so much. How we got over it was we're just praying that everything should settle down, praying that vaccine should come so that we will get out of it, praying we'll have a good treatment protocol. Treatment protocol also, see, for any virus, see, a common cold, but even if you treat a common cold or if you don't treat a common, it will take 1 week to go. So that is the biggest problem. Antiviral drugs are not very effective. But now we have found out antiviral drugs for these viruses. The treatment schedule protocol has so much evolved. Now we are confident that we can get over, even if I get a Corona, I can get over it. Of course, a few people have, like for celebrities who died, when they died, it shattered our ego, like SP Balasubramaniam, our ex-president Pranab Mukherjee, who died of Corona. Cricketer Chetan Chauhan, I think he died of Corona. A lot of Bollywood celebrities, Irfan Khan, all of these people died of Corona. This had shattered the strength within a person. Now, all of us were resting. But I think with time is a very good healer. So we have come back, bounced back. The doctors have really bounced back, and there's no issue now at present.
Doctor, you said that some doctors faced hypertension. This hypertension could be caused because of understaffing. Understaffing in hospitals have always been a serious concern. How was it like to deal with understaffing in this pandemic, doctor?
So the moment Corona came in, everybody got scared. All our staff from the hospital ran away. Please, particularly people from other states, they just vanished. We had very little skeletal staff in our doctors came. Doctors didn't come initially, but after that, doctors did come to the clinic. But the staff, like the nurses, the paramedical, health assistants, ward boys, all of them ran away because they're scared. So in the house, they'll say, if you go and work in the hospital, you get corona. So this was a very big issue for all of us. We were all, we didn't know how to work. But luckily, we did not have patients that time. Not much of patients came into the hospital. But after some time, corona cases came into the hospital. They all jumped into the hospital, and our load into the hospital became increased. That time, we did not know what to do. We tried to call, some of them turned up. The only way we were able to manage is pay them double. And that was an initiative for us to get back our staff. And with the skeletal staff, we did run, paying them really well. We were able to run the show.
So speaking of shortages, in the beginning of this pandemic, the demand for surgical masks skyrocketed, which prompted many doctors to respond by posting videos about how they needed surgical masks more than the average consumer. So how did the availability of personal protective equipment change over the course of the pandemic in your workplace?
This corona made us to wear masks everywhere. Everywhere become a surgical place for us. We were forced to wear masks. In fact, we were the most affected people because we are the ones, frontline workers who are working with the people. We are working with the patients. So we were most affected if you do not have masks. And initially when it came, it was not too much of masks were there. So doctors were so much deprived of masks. They kept on asking government to give. Government supplied us masks first. Then, of course, pharmaceutical firms, they helped us to give us masks. Then some business firms gave complimentary masks for all of us. So masks were supplied from everywhere. Government was so helpful. Were supplied for everywhere, and we were stocked with enough masks for us and for our paramedical staff. So we continued the work. So it was difficult initially, but we managed to get enough. Now we are packed with masks everywhere. In our house, every room has got masks.
That's good to hear, doctor. So more and more people are getting vaccinated each and every day. Even my parents got vaccinated last week. But there have been some apprehensions about being vaccinated. So considering the misinformation circulating around its effectiveness, what is your opinion about the vaccines?
Vaccine is our only savior. I told you for corona, the treatment is there, but still you will have the side effects of the disease lingering you. Particularly, it's a respiratory disease. It can spoil your lungs. You can go in for a lot of changes in your lung, which can hamper you throughout your life. But if you prevent corona, that's the only way. We have had deadly diseases. Medical profession has seen deadlier diseases than this, like diphtheria, smallpox, chickenpox, tetanus, rabies. All this we have seen. All this we have overcome only with the vaccine. Please understand. All of us, all of you have been vaccinated when you were young. The moment a child is born, up to 3 years, vaccine, nothing else. And vaccines have been put by mothers to their small kids from time immemorial. But I do not know why people are scared of this vaccine. This is also another. What is a vaccine? Vaccine is nothing but a dead virus or a live attenuated virus or a protein of the virus taken from corona, injected into you, so that your body produces antibodies to the coronavirus. That's all. That is what is vaccine. When it comes to corona, why people are scared, I don't know. Probably because the side effects. Sometimes some people say, I had fever, I had body pain, I was deadly tired. All these people say. It is there with any vaccine. Please understand. If you put tetanus vaccine also, you'll next day, a DPT vaccine, you'll get triple antigen, you'll get fever. If you take rabies vaccine, you will get fever next day. You will feel tired. But the media made it like some people said, some people died of vaccines. Here one fellow, Hyderabad died. All this misinformation from the media really scared people. Really scared. Elderly people are so scared. They were not willing to take vaccination at all. But vaccine is the only way we can get over corona. There is no other way. They may say that there are people who, even after vaccination, they got corona. Some people do not get enough immunity after taking a vaccine, enough immunity. But second vaccine really boosts. First vaccine gives you about 30 to 40% immunity. The second vaccine increases your immunity level to 80 to 90%. So one or two people have got corona after the first shot. So they said, no, this vaccine is not effective. This is there for any vaccine. Please understand. We give on giving you booster vaccines every year, even after child. You can take a DPT in the first 3 months of life. Then you take it once a year, once in second year, third year. So you have to improve your antibody level only with vaccines. So like flu vaccine for SARS and all, we take flu vaccine every year. We take it's an annual vaccine. Please understand, and we keep on continuing the vaccine every year to get immunity. So similarly for corona also, after a year we may have to repeat another vaccine. No other way. So vaccines are the only way. If you take a vaccine, you not only protect yourself, but you are protecting others from getting the disease. Like if you take a vaccine, you are protected. But if others takes a vaccine, then the herd immunity will increase so much in this country. So all of us will be protected. We did not have to worry about corona. But vaccine is our savior. Please understand. With folded hands, I request all people to take vaccines so that you protect this countrymen. It's not for you. You don't be selfish. It is to protect our countrymen so that I don't pass this infection to others. So vaccine is a must. There's no second thoughts on it. Lot of misinformation about vaccine is going on, but all this is not true. Not true. All over the world, people are not fools to take vaccines. Please understand. Everybody is taking vaccine, and we've been taking vaccine for smallpox is a killer disease, but it's not present in the whole world now only because of vaccine. So please understand that vaccine is the only way we can save this country from corona.
And to our final question, seeing that the second wave is here, Doctor, what can we expect this time?
This is very unfortunate. Yeah, the second wave has come. It has come because all the government hospitals are full now. All the government hospitals are full, and private hospitals are all getting filled up with corona cases. So why the second wave came is a mystery for us. Why it came? Probably it's because of the laxity among us. We thought, yes, 6 months over, 8 months over, 10 months over, we are through. Nothing to worry. Number of cases have come down. So we removed our masks. We forget about social distancing. We forget about washing our hands. It's man's mistake which caused the second wave. If all of us had followed it for quite some time, you just go see, there were no malls, no cinema theaters, nothing was there, isn't it? Nothing was there. When everything started, the second wave has come, which only means the virus is still there in the community. So the only way is, once again, like if you have a lockdown, then the whole thing will go away. By the time vaccines, then people also thought, I have vaccinated, why should I worry? Please understand that one vaccine cannot give you 100% immunity. It will give you only 30% immunity. The booster vaccine only will give you 80%. Even then, you'll get only 80%. You cannot get 100%. No vaccine says we'll give you 100% immunity. So you have to be careful. The second wave, if it becomes like the first wave, shattering us for the whole year of 21, all of us will become hypochondriacs, will become depression will hit us. All of us will get anxiety, neurosis. Already people in the offices are working at home, You remember, all of them are work from home. All children are not going to schools. Colleges are closed. Everything is closed. What will happen? Please understand. But if you do not want a second wave, you have to behave yourself. That's the only thing. The only advice I give all people is still maintain the social distancing. Still maintain, because Zoom meeting has come to stay. Like all of us are saying, I've not attended a doctor's meeting for the last 1 year. We used to meet every month, have IMA meetings. All that is gone now. Physical meetings, personal meetings are gone. It's all, and we've adjusted to Zoom meeting and all these other platform meetings. So please continue it for some more time till you get vaccinated. The entire herd immunity increase in this world, in this country. Then we can need to fear the second wave.
So thank you, Doctor. With that question, we have reached the end of our interview. It was a pleasure to have you here, Doctor. I'm sure your answers would help our viewers stay informed. We thank you on behalf of the HUS community, and we are extremely grateful to interview you today.